All right, everybody's pouring on in. We have such an amazing, interactive, engaging group. Dr. Woodley, you are going to love this. Hey, Alicia, glad you're here. You guys, Dr. Woodley is absolutely wonderful. A lot of you guys may have seen Dr. Katie and I, gosh, a couple months ago now, but who has any concept of time? Where we got to talk about holistic pet medicine and medicine in cats. And so we are so excited to have you here, Dr. Katie, a very good friend of Basepaws. If you guys have not met or don't know yet about Dr. Katie, she is a veterinarian and she is also the owner of the Natural Pet Doctor. And so you can find her on social media. She's a holistic pet wellness expert. She speaks, she writes, she educates. She specializes or has a special interest in cancer prevention, but today she's here talking to us about chronic kidney disease. And this is just, I think, a near and dear topic to everyone's heart. I know we'll have lots of questions, guys. Don't forget to throw them in the Q&A, and you guys can interact in the chat. So I'm going to step away and let you do your thing. Dr. Katie, thank you again so much for being here.
Okay, great. Thank you so much for the introduction. I am so excited. I'm going to go ahead and share my screen with everyone so that we can get going with our presentation for today. So just bear with me 1 second. And okay. And what I'm going to do, so what we're going to be taking questions at the end. I am going to launch a poll for everyone to take a look at and start answering those questions as I run through just a brief cover, like what we're going to cover, topics we're going to cover with this important disease that is so common in cats. So I'm going to launch that. So please feel free to answer those questions and let's get going. So I'm Dr. Katie Woodley, the Natural Pet Doctor, and we are going to talk about integrative approach to feline chronic kidney disease, so important in so many cats. And what we're going to talk about today, so we're going to talk about what exactly is kidney disease, what are the symptoms of kidney disease that you need to be watching out for, diagnostic tests that your veterinarian most likely will want to run, and tests that you may need to ask for to have done at your wellness exams every year. We're going to cover nutrition. And then, of course, we're going to be covering some of those natural remedies, which is the thing that I love for treating and helping prevent chronic kidney disease in our cats. So once again, I'm Dr. Katie Woodley. I am a holistic veterinarian, and I founded the Natural Pet Doctor, where I help pets thrive and achieve vibrancy for life through holistic medicine such as nutrition, acupuncture, herbal medicine. I'm based in Fort Collins, Colorado, but I offer telehealth consultations to pet parents worldwide because people need these options to be able to integrate it into conventional medicine. So first off, I wanted to start with this handsome boy, Finn. So he's currently one of my patients, and I've known Finn for a long time. I've taken care of him when I used to work at the vet clinic, and he actually is a good example of what can happen with kidney disease. So he actually had chronic kidney disease and he was doing fine, but he had an acute onset of kidney problems. So what happened was he stopped eating, he got really sick, he was vomiting. His amazing pet parent took him into the vet clinic and he had to stay for a couple days on IV fluids. However, he didn't respond. And so they said to him, you know what? I think you should take him home, spend some time with him, and when the time is right, bring him back and we'll help him pass peacefully. His mom reached out to me and she's like, Dr. Katie, I need your help. I am not ready to let Finn pass. And so what we did is we took a look at Finn. We assessed some of the diet changes that we could make, and we used herbal medicine. And Finn is here 2 years later, thriving. His values dropped from stage 3 kidney disease, and he's doing really, really well. So this is the power of being able to integrate holistic medicine into our pets' treatment protocols so that we can help them thrive and feel healthy and also gain more good quality life with them. So what exactly is kidney disease? If you have a cat, you're here, you probably have a cat or you're thinking about getting a cat. Unfortunately, 3 in 10 cats will develop kidney disease at some point in their life. Normally, healthy, happy kidneys are going to do a great job of eliminating protein waste through the urine. They help maintain fluid balance. They produce certain hormones. They regulate many of the electrolytes in the body. But when kidney disease happens, so those kidneys aren't functioning as well as they should be, it compromises the kidney's ability to perform these important tasks. So we can break down kidney disease into two different categories. The more common one that we're going to touch on for this presentation is what we call chronic kidney disease. So this is when the level of kidney function declines slowly over time. So cats usually compensate for anywhere from months to even years. And we can see sometimes mild signs of illness, like they just have a decreased appetite, maybe a little bit of weight loss. However, these changes progress as the kidney disease worsens. So this is the most common metabolic disease of cats. Most cats are affected over the age of 12. So we're looking usually for our senior kitties that are developing these. And remember, this is a slow decline. However, like Finn had, we can have these acute onset, acute kidney disease like attacks, where a cat suffers a severe abrupt injury to the kidneys. So they become really sick. They may stop producing urine altogether. And ultimately, a lot of times, unfortunately, that leads to death. So we're going to talk about chronic kidney disease. We're going to, since this is so common in our cat population, but we're going to touch on how herbs and natural remedies can be used for both of these. So what are some of those common causes, potential causes of kidney disease? There's a lot of them. So anything that can decrease blood or urine flow to the kidneys can lead to kidney degeneration, kidney disease. High blood pressure. So this is super common, especially if there's hyperthyroid problems with kidney disease. There is a lot of cats will have high blood pressure, cancers, obstructions such as kidney stones, if they ingest toxic substances, antifreeze, pesticides, medications, cleaning chemicals. If your cat has advanced dental disease, there's a lot of bacteria in cats' mouths, can get into the bloodstream. Those kidneys are filtering it. So that can lead them down the path to developing kidney problems. Some of the long-haired breeds, so Persians, Angoras, they can have a genetic predisposition to the disease. So definitely take advantage of Basepaws genetic testing because they're doing amazing work to identify if maybe your cat might be prone to developing something like this later on in life. Usually they're older, so older than 7 years. Most are being diagnosed after 12 years of age. But this is where it's so important for preventative care, annual wellness checks, getting the blood work done every year. Foods that are high in phosphorus content can make those kidneys work harder. And outdoor cats. So what that means, outdoor cats have a higher risk of coming into contact with those toxins, with antifreeze on the street. So they have a higher risk of those acute kidney disease problems. So what are you going to see if your cat is developing problems with their kidneys? Usually it's very subtle signs. So this is where we can see increased drinking. They might be peeing more. You're noticing more, like a bigger amount of urine in the litter tray. They have a decreased appetite. They may be vomiting. Other signs that you might see, bloody or cloudy urine. So bacterial infections are a lot more common because those kidneys aren't able to concentrate the urine, and the urine is more dilute. So bacterial infections can develop much more easily. They might have a poor coat appearance. They're tired. They might be losing weight. The best place to monitor if your cat is potentially losing weight is along the spine. Does the spine protrude more? Do they feel more bony along the spine and along the hips? Did they all of a sudden develop bad breath? Do they have a sore mouth? Diarrhea, constipation, sleeping more. Okay, so there's a lot of signs, right? So the thing is we need to remember these can be signs of disease for so many other conditions. So hyperthyroidism, urinary tract infections, diabetes, cancer. This is why we need to be bringing our kitties in to the vet clinic at least annually so they can get checked out. And I highly recommend starting annual blood work so that we can assess if anything is changing in your cat, because we don't want to wait until about 75% of the function of those kidneys is gone, because then it's a lot harder to treat and help your cats. And like I said, these signs are very subtle at the very beginning, but if we have that base blood work, we can track trends, which is really, really important. So some of the tests your vet might run. So these are going to be blood work and then a urinalysis. So the complete blood count, so CBC. So this is looking at, is your cat becoming anemic? Do they have enough red blood cells? Are there signs of infection? Are their neutrophil counts normal? And then their chemistry profile with electrolytes and an SDMA, which we're going to talk about in a few slides, how important that is. So BUN, creatinine are the common ones that we look at, but also electrolytes, potassium, what is their phosphorus and their calcium levels? Your urinalysis, we're looking for infections, dilute urine. Urine cultures are going to help us if we have dilute urine to see if there is an infection present, and we just can't see it under the microscope because that urine's too dilute. We can do x-rays. We can do ultrasounds of the kidneys. We can see if these kidneys are small and shrunken, or if one's bigger, there might be a sign of cancer or something's going on. So these are great diagnostic tools. We always want to check blood pressure also to make sure that our cats are not hyperthyroid, and we need to be checking thyroid because a lot of cats develop hyperthyroidism as they get older, and it can mask kidney disease. So when we treat the thyroid, we can actually uncover kidney disease, and some of these cats will go into kidney failure. So this is really important. How do we diagnose this? So as I mentioned, we're going to do those tests, right? But we're looking for elevated creatinine levels. However, that's not usually elevated until about 75% of kidney function is gone. So this is where this SDMA test is really important to make sure that your veterinarian is using these at the annual exam, because this can pick up. So the elevated SDMA will happen when there's only 30% function loss. So we can pick up kidney disease a lot faster. Also, is the urine concentrated? So a low urine specific gravity, or USG. So we see that on a urinalysis. And then if we're doing those x-rays, the ultrasound, what do those kidneys look like? Is there abnormal kidney imaging? So this is a brief, there's a lot of information on this slide. So we typically go through a different, like a pathway when we're diagnosing chronic kidney disease. We're using the creatinine, we're using this SDMA test, which is a newer test that helps us identify kidney disease before 75% of the function is gone. And what it is, it's a high sensitive marker of the glomerular filtration rate, so the GFR. So an increase will clearly help indicate if kidney function has declined. So if we pick up a high SDMA and creatinine is still normal, what we typically do is we will recheck an SDMA. So if we're finding that that value is staying high repeatedly, then we go to the kidney imaging, ultrasound, x-rays to see if those kidneys look normal. And then also on the urinalysis, we're looking for protein. Is that kidney functioning well enough to keep the protein in the body, or is protein being lost out through the urine? And then also looking at the specific gravity. When we diagnose kidney disease, so we have those elevated markers, then what we typically do is we go through and we stage kidney disease. So if you have a cat currently with kidney disease, this will probably be very familiar to you. There's different stages that showcase how high these levels are and where your pet is at. So stage 1, stage 2, those are going to be earlier stages. Stage 3, stage 4, that's where your BUN, your creatinine are really elevated. Your SDMA is higher. Those are the toxins that the kidneys aren't able to excrete through the urine. And typically with these later stages, your cat does not feel well. So we use this to help us treat based on where your cat currently is and what stage. So what's the next step? So we've done the diagnostics. We say, okay, your cat's in this stage of kidney disease. Now your vet's going to customize specific treatments for your cat depending on how they feel. That's really important. The severity of kidney disease. And also, does your cat have other medical conditions in addition to kidney disease? So some cats, they need to be hospitalized early on, especially if we're in stage 3, stage 4, your cat's not eating. So typically we're going to do IV fluids. But if your cat's doing fine, we're in early stage of kidney disease, they're still eating, then typically we manage them outside of the hospital at home care. So we can do medications depending on what's going on in the blood work and how your pet's feeling. But the key treatment strategies that we want to focus on is supporting hydration. We don't want your cat to become dehydrated. Reducing phosphorus content. So this is usually done through protein restriction. Regulating blood pressure, so ensuring that we're checking that when we're concerned with kidney disease in our cats, and also controlling calcium levels. And like I mentioned, the intensity of intervention increases with disease progression and with the way your cat is feeling. Integrative treatment goals. So this is what I look at when we're looking at how do I slow down the disease progress? How do I support your cat? We need to be mitigating oxidative stress by using antioxidant herbs. Essentially what this means is there's inflammation in your cat's body, and we can help support them better by integrating in these herbs that help reduce that inflammation naturally. We want to usually improve renal perfusion. So we want to help blood flow to the kidneys. Those nephrons, the functional units of the kidney, aren't functioning well. And a lot of times when we increase blood flow to the kidneys, we can revive them. We can reverse kidney disease. However, I said in most cases, because if your cat has a severe infection in the kidneys, if we increase blood flow to the kidneys, we can potentially worsen them. So that's where we have to look at each individual case, what's going on, do the diagnostic so we know how to manipulate that blood flow using certain herbs and supplements and nutraceuticals. We want to prevent fibrosis. This is scar tissue from happening. So this is a natural consequence of renal disease over time. If we get scar tissue, it is really hard to reverse that. So we definitely want to prevent that as much as possible in the early stages. And then, of course, we want to optimize systemic health and well-being. We want your cat to not know that its kidneys are not functioning as well as they should be by keeping them eating, feeling good, well hydrated. So what are some of the treatment options? When I'm looking at your cat from a holistic perspective, diet. Diet is the foundation for health. We need to ensure your cat is on the most optimized diet for where it is at. Vitamins. What certain vitamins are being lost through the urine? What do we need to supply extra to this cat that is dealing with its kidneys not functioning well? And of course, herbal medicine. This is huge. This is a game changer for my patients in reversing and maintaining kidney function. So nutrition, huge controversial area. And despite numerous studies, clinical trials, there are still questions about feeding protein to cats with chronic kidney disease. Some of the questions that come up is, what is the optimal amount of protein for a cat with chronic kidney disease? How much restriction is truly necessary? Do different stages of kidney disease require different dietary therapies? At what point in disease progression should we restrict protein? And does the type of protein make a difference? So depending on where your cat is in those different stages, they're going to need to be on different diets. So that is key. And we need to think about diet as the foundation and how we help support this cat's body, because we don't want to limit protein so much that they go into protein deprivation, and then we are taxing the kidneys more. Biggest thing with cats, we need to remember that they're obligate carnivores. They need meat to live. They need protein in their diets. So the question is, what type, and is it high quality? So when I look at kidney diets, I put an example up of one of the most commonly prescribed kidney diets. So KD, so Hill's, Royal Canin, and then there's other therapeutic brands out there. So there's a lot of options for kidney diets. So I always look at, okay, where are we? What stage are we in? My first question though is your cat getting enough hydration from their food? That's key. Most cats, they're poor drinkers. They don't drink enough water. They don't drink it as readily as dogs do. So we have to be providing it in the cat food, regardless if your cat has kidney disease or not. Unfortunately, dry foods, they're only 10% moisture. And cats that are fed dry food diets their entire lives, they've actually been subclinically dehydrated. And like I mentioned at the very beginning, one of the predisposing factors of kidney disease is reduced blood flow to the kidneys. So that dry food we're feeding to our cats is potentially compromising their kidney health. So I also want you to look at the ingredient list that I put up here. So this is the ingredient list for one of the most common kidney diets. It's a dry prescription food. And when I look at a cat that's been diagnosed with kidney disease, acute, chronic, SDMA is elevated, maybe your cat is acting fine, the first thing that I look at is, one, are they getting enough water in their diet? Two, we need to get them off kibble. That's the biggest thing. In this food, you can see that corn is the predominant ingredient. It's number one. So it's listed by percentage of those ingredients. So corn's the predominant ingredient. You're going to notice also that there's a thing called ingredient splitting going on with this food, where there's also corn gluten meal. We have wheat gluten. Remember, cats are obligate carnivores. Is this diet a biologically appropriate diet for them? Does it have high quality protein sources in it for them? Or are we using pea protein, which is not necessarily the most biologically available for cats compared to meat protein? So we need to look at these as a pet parent. Number one thing, learn how to read the pet ingredient labels. You can go to my blog post, you can go to my website. We have lots of information, but we need to know, what are we putting into our cat's body? That is number one. So with kidney diets, biggest thing, real food from an integrated perspective has so many benefits for these cats. That includes palatability for cats that have decreased appetite, and these benefits can actually outweigh those offered by processed foods. So in IRIS stage 1 and early stage 2, usually those diets don't necessarily need to be modified with the protein content, but we need to be watching the phosphorus content of the food and assessing where is that cat in those stages. Once we get to late stage 2 and onwards, then we look at reducing protein by diluting that with fat and carbohydrates. Now remember, good quality protein, that's key. We also need to be assessing, are there enough omega-3 fatty acids? So usually like fish oils that are going into our pet. So those are going to help reduce inflammation, support kidney health. And then also, does this food have low sodium content? Does it have extra vitamin B vitamins to support kidney health? And then looking at probiotics, adding in probiotics to support the microbiome, the overall gut health, and the immune system to help reduce inflammation even more. So what are good diets? There's so many options, right? It's so confusing. So when I look at these diets, I want you are a cat parent or you're thinking of getting a cat, you need to write down this website and check it out, catinfo.org. It's made by a veterinarian, and it has so much information on how to feed your cats the appropriate diet. All of the brands are listed too. So good brands, bad brands, but you can look at the fat content, the protein content, and the carbohydrate content, which you won't find on the back of a bag of cat food. So, or on a can. So you can go there and assess, okay, we want less than 10% carbohydrate content. So then we can look at higher protein. What are those ingredients? And assess the pet food labels to make sure this is a biologically appropriate diet for those cats. And we can also, what's another great resource at this website is phosphorus content of all those foods. So we can pick lower phosphorus content. Balanced home cooked diets. So that's something I do for my patients, making sure that we're optimizing the diet, that it works for them, that it works for you as the pet parent. There are prescription raw diets that a lot of cats will do really well with. Darwin's is a good brand that has one specifically for cats. And then of course, get them off kibble. Regardless, getting them off kibble will be the #1 difference to the health of your cat, but check out catinfo.org for other brands that you can use. All right, natural remedies. This is my jam and my most favorite part of what I do and practice every single day. Can we reverse kidney disease? If I was talking to you from a conventional medicine perspective, I would say no, but I'm not. And I'm going to say yes, because we do it every day. I see the values reverse, and it's because we're using herbal medicine to improve kidney function. Herbs can delay the onset and progression of chronic kidney disease because it helps improve mitochondrial function in the cells. They provide antioxidant protection. There's a lot of things that they do. They're anti-inflammatory, anti-fibrotic. They protect the kidneys. They can improve kidney blood flow. And one of the really neat things about herbal medicine is that the formulations a lot of times will contain multiple plants. So we get a greater result with less side effects because we have a synergistic effect of these plant compounds working together. Super cool. And then we can also use acupuncture to help improve blood flow and help support the overall health of your cat. So one of the herbal medicines that, or herbs that we use a lot, plants, Remania. If you have a cat with kidney disease and you've been doing research, you've probably come across Remania. It has a long history of research and effective use in chronic kidney disease. In humans, studies have actually found that it has a 91% efficacy rate in reducing kidney damage from nephritis. So due to enhancing kidney blood flow and improving that glomerular filtration rate. Another study actually showed too with rats that were ligated, so they decreased the blood flow to the kidneys. They found that Remania extract actually improved renal blood flow to almost normal levels, reduced mortality, and also reduced hypertension. So a lot of these things that we're using conventional medicine for. So if your cat has high blood pressure, we can use Remania to help reduce blood pressure naturally with less side effects. And we can use it together. We can integrate it in with conventional medicine. You're going to find that Remania is in a lot of Chinese herbal medicine. And let me go to the next slide. So these are some of the supplements that are out there in the US that you might come across. Remania 8 combination is a really popular Chinese herbal medicine formula. My disclaimer for Chinese medicine is that the Remania 8, you need to be working with a veterinarian that does Chinese medicine because it's individualized medicine. So based on your pet's personality, the things that they have going on, I may pick Remania 8, or I may pick another formulation that's better suited to your cat. We can cause issues if we're just picking these formulas because I read it online and it said it would work. So that is something that we need to be aware of and be careful with. Now, 2 of the other supplements that are great, fantastic, and as a pet parent, you have a cat with kidney disease, you can use these safely. RX Renal Feline from RX Vitamins and VetraScience Renal Essentials are 2 great options that you can utilize for your cats. And they have combination of different nutraceuticals, they have Remania present, and they also have this amazing plant. So this is Astragalus, and this is known as a chi tonic in Chinese medicine. And it's a major immune modulating herb in Western herbal medicine and acts as an adaptogen. So it works in the body where it's needed. It has major antioxidant effects, and it has shown promising results in numerous studies to help reduce protein in the urine. If your cat has protein in the urine, we need to get that under control because it can lead to more damage to the kidneys. So Astragalus is found in all those previous supplements that I just mentioned. And keep in mind, a lot of these nutraceuticals and the herbal medicine and other supplements are going to combine these together for the maximum benefit for your cat's health. Now, medicinal mushrooms. So these aren't the things that make your cat high or make you high. These are the things that you can actually eat and use for medicinal properties. And the cool thing is mushrooms are actually well tolerated by cats when they're given in the form of powders or concentrated tinctures and added to the food. I even have cats that will eat mushrooms out of their home cooked diets. It's pretty impressive what cats will eat when they realize that real food is actually tasty. So who knows what these mushroom species are? You can comment if you know what these are. So these are some really cool ones. Ganoderma is one of them, and it's a medicinal mushroom that's been used in China, Japan for hundreds of years for its immune modulating, anti-inflammatory, and anti-tumor effects. It's also called reishi. So Ganoderma compounds are also kidney protective. The active compound acts and helps counteract the oxidative stress. So it's reducing inflammation from that decreased blood flow to the kidneys. The other one is the cordyceps sinensis, and this is also extensively used by Chinese physicians to treat chronic renal diseases, and it also can help stimulate the immune system. And it's commonly used in renal transplant patients on the human side, and it can also improve renal fibrosis. That's scar tissue. That's how powerful these supplements, the using real food as medicine, can help. And then we have, this is milk thistle. And this is one of our most common kidney protecting herbs. It's a potent antioxidant and free radical scavenger. You probably have heard of it if you're looking at liver health, protecting the liver, or even like detoxing. And there's a lot of evidence that supports milk thistle and showcasing the regenerative effects that it has on renal tissue after injury. So Animal Essentials milk thistle is a great brand if you're thinking of using the supplement alone, and you can get this in the States. You can just get it online. It's also really good to support the hepatic health, so liver health, help detox the body, because remember, the kidneys are not functioning as well. So they're prone to building up more toxins in their body. So if we can help the liver process those, help support the kidneys too, we're working together. Everything's working together to help your cat feel their best. And then one of the treatment modalities that I love, game changer in my business, alongside using herbal medicine, is acupuncture. And yes, cats can tolerate acupuncture. And acupuncture is amazing. And we use tiny little needles. There's certain points along the body in the meridians that we can use to help release endorphins, help natural pain control. So the needles stimulate natural opioids to be produced by the body. There's kidney points that we can use to help increase blood flow to the kidneys. There's anti-nausea points that we can use. Your cats feel amazing and they respond really well. So look for an acupuncturist in your area. It's an amazing modality to help your pets feel their best. And you can use that alongside conventional treatment. You can use it alongside herbal medicine. That's what I love about all these different options. We can integrate them in together. It doesn't just have to be one or the other. And there's so many options. These are just a small number of the things that we can use to help support your cat's health. So that was a really fast kidney disease summary of how we can integrate herbal medicine, and wanted to make sure we had enough time for questions. But in summary, we talked about what is kidney disease. 3 in 10 cats will develop it. So we need to be watching for it, need to be doing that annual blood work, doing those diagnostic tests. If your cat is feeling off, don't wait. Take them in. Preventative medicine is key. We want to diagnose this as early as possible, so then we can implement all the things we just talked about to keep your cat feeling amazing and their kidneys aren't degenerating, and we can keep them in those earlier stages, or even reverse it where we can't identify kidney disease anymore. There's lots of different treatment options. Keep that in mind. If you're told there's nothing more you can do, find an integrative vet, find a holistic veterinarian to partner with your conventional vet, so that all the options are offered to you. Assess nutrition, learn how to read those pet food labels, get your cats off of dry food. So yes, it can be a hard transition, but this is key. Right now, day one, let's start transitioning these cats off of a dry food diet, get them onto canned foods, look at balanced home cooked diets, working with a veterinarian that can do that to ensure that they're getting all the nutrients, the vitamins that they need for optimal health. And then looking at and integrating these natural remedies. So we just covered only 4 of them: Ramia, Astragalus, your medicinal mushrooms, your milk thistle, but there's so many more. These are a few resources, lots of studies. Go to PubMed, check it out, type in kidney disease, cats and kidney disease, herbal medicine. If you're really like a nerd like me and love seeing all the research that's out there, and there's so many more studies that are being done. So it's a very exciting area, and there's lots that we can do to help your cats thrive and live a long and vibrant life. You can find me at thenaturalpetdoctor.com. Check out our blog posts. We talk about nutrition, cats, general health and wellness. Go to our Instagram, The Natural Pet Doctor. We post 4 times a day. We have lots of content. You can like our Facebook, also The Natural Pet Doctor. We have a private Facebook community for amazing pet parents like yourself, where I go live every Wednesday at noon. So I can answer your questions. I love helping support you. Make sure you know that there's options out there, and definitely subscribe, like our YouTube channel, Dr. Katie Woodley, The Natural Pet Doctor. We post videos 3 times a week on our YouTube channel. So lots of free content. And if you need help, I do telehealth consults if you're not in this area. So check out thenaturalpetdoctor.com. All right. I know that was fast, but I know that I can see people asking questions. So Becky, let's get to it and answer all these questions.
Let's do the best we can. They're all really, really great questions. So I think one that I see coming through quite a bit and is a great question is just how can these modalities be used together? So can milk thistle and essential oils be used together? Can, acupuncture be used with all these different things? So tell us a little bit about that.
Okay, great question. So when we're looking at integrating holistic in with conventional, so this is key with working with a holistic veterinarian. So a lot of times I'm not changing the things that the conventional vet is doing. I partner with them. So if your cat's on benazepril, say they have high blood pressure, we're going to continue that. But what we're going to do is we're going to look for the imbalances in the pet's body. So why did this happen? Is their digestive tract weaker? Are they prone to vomiting, diarrhea? How do we use those herbal medicines to support? So when we're looking at basic supplements, so let's say you want to look and see, okay, I want to try this supplement. Let's try the VetriScience Renal Essentials because my cat's been diagnosed with stage 1 kidney disease. You can integrate that in and use that. It's a safe supplement to use. I wouldn't use it as a preventative. So we want to diagnose kidney disease first, but that's where food, making sure that they're on the best food first, and that you're feeding the best diet possible if you're looking at preventing the disease. Now with acupuncture can be used for preventative. It can be used for treating. The thing with acupuncture is that it's not going to interfere with anything. That's the beauty of acupuncture. With herbs, so let's say with kidney disease, typically your herbs aren't going to interfere with any conventional medicine. I treat a lot of cancer patients, and that's where working with someone that knows what those herbs are doing and how they can potentially interact with chemotherapy drugs is very important. And so that's where I don't recommend clients to just try all the different supplements and things like that. But these can be used together. Essential oils, I've done essential oil webinars on how to use them safely in cats. We can integrate them together, but my biggest take home point too for cats can be sensitive and we don't want to put them off their food. So we don't want to add 13 different things all into their diet. So keep that in mind. That's where we're working with an integrative vet to find the powerhouse supplements that are going to make the biggest impact. So you're not giving too many things and putting your cat off of food. That's key.
Well, and so that's actually a great segue into the next question I wanted to ask. So the treats are such a hard problem, right? Because of the phosphorus content and concerns, and some of our watchers and viewers today are expressing this. And so what do you think are safe treats for your CKD kitties?
So what I would say is if you can find a diet that works for them that they like. So it's interesting what cats will eat. I have cats that will eat broccoli or will eat, we can do little bits of high quality protein. So sometimes utilizing little bits of sardine, but we don't want to be doing that every day because that can be higher in phosphorus content. So if you have a cat that's on a homemade diet, you can use that. Also, you can use little small pieces of cheese. So raw goat's cheese is great. Answers Pet Food has a lot of these too that you can use for treats. So small little bits for the treats. It's a hard place to be in. If we're using the dry cat food treats, less is more, right? So we want to ideally get them off of dry food because it's not helping them in terms of the subclinical dehydration that I talked about. So looking at maybe using some of these real food options and looking at what phosphorus content is in those foods and then using less of them and ensuring that we're not overdoing it throughout the week.
I love that idea. And it sounds, I think my cats would love goat cheese. So, so we've got a question here that I think is a really super valid too. And, you talk about measuring blood pressure and, the concern is that blood pressure at the veterinary clinic is probably not super accurate. So speak to that for us, if you would.
Yes, this is a common problem. What I would do is I would ask your veterinarian if you can have a veterinary technician, vet nurse, come to the car and do the blood pressure check in the car. If it's only slightly elevated, it's probably from stress of travel, the crate, all the things. If you can see if they do house consultations too. I know some clinics will have a technician do a house call and they come to you and they can measure that. So if we're worried like there's a borderline issue, then seeing what they're able to do. When I worked in a conventional clinic, our technicians would go to the car and that helped a little bit. I mean, if we're seeing that the blood pressure is over 200 and the cat's just kind of sitting there, yes, cats are really good at hiding how they feel sometimes, but if it's over 200 and it's consistently over that amount and we're doing the things to reduce the stress, it's probably truly elevated. And so then we do need to use that treatment. But that's where some of these Ramia and these herbal medicine combinations, we can bring that blood pressure back down to normal because we're using these herbal medicine versus using something like benazepril.
Wonderful. It's always such a problem, right? So I guess the other thing, okay, wait. To tie into that, what is considered high phosphorus and how is it measured? So tell us a little bit about, do you have recommendations for content and quantities?
Okay, so let me bring up, it's in this chart. Let me see, I believe it was in one of the charts. Maybe it's not on this one. So with your phosphorus content, so this is where your veterinarian is going to do blood work. That's one of the ways that we diagnose, is there a kidney problem? And what do we need to do about it? Do we need to put them on a phosphate binder? So that's where, if we're worried that typically in the States, I believe the high end is 6 and it'll vary. So if you're in foreign countries, they measure it in different measurements and they're all the same. It's just the millimole per liter versus, I can't remember that actual one for overseas. However, if it's typically over 6, that phosphorus content is too high. When the phosphorus is too high, they don't feel good, they're going to eat less. So that's where we use phosphate binders. And there's all sorts, RX Vitamins has a natural phosphate binder that I use. There's epichitin, there's all sorts of different phosphate binders, but that's where the blood work, it's part of the panel. It's in the routine blood work that your cat gets every year. So those are the things that we're looking at. So that's why this is really important. Routine blood work from year 1, you can track trends. Remember, there's a range. We have these ranges for BUN, creatinine, electrolytes, phosphorus, calcium. So if we're seeing trends tracking high over the years, we can go, hey, there's something going on here. We need to support the kidney health a lot better. We can start implementing some of these changes before it becomes a problem, before your cat knows it's sick.
It's amazing. That's so true. So speaking of before it's a problem and before your cat is sick, do you have, what are your recommendations for prevention? You talked in the beginning about how prevalent this disease is, and it almost feels like inevitable, right? Like the older your cat gets, you just feel like you have this little furry, or possibly not furry, ticking time bomb. So can you speak a little to kidney support and helping to prevent this long term?
Yeah, that's a great question. So it's not like we just wait until the cat gets sick, right? That's not preventative medicine. The biggest thing that we need to do is we need to make sure the diet's appropriate. So if we're feeding dry food, and it's so hard, I had two senior kitties that we adopted through this pandemic, and they were addicted to carbs. So I understand the struggle is real. They are addicted to dry food. And the biggest thing is okay, let's look at the dry food. What are the most optimal diets that we can use? Ziwi Peak is a great one that uses organ meats. It's air dried. It has real meat in it. So looking at, okay, what proteins are present? Are we using mainly pea protein? That's not ideal for cats. And then offering alongside the dry, these canned foods. offering potentially doing transitioning over time to a raw food diet. If they like can, then can we get them to some of these other diets that are going to be more biologically appropriate for our cat's health? Because they're obligate carnivores, they shouldn't be eating dry food. It's really high in carbohydrates. Usually it's at least 30%. And there's a lot of things in those foods, and it's drying them out. They don't like drinking water. So that's key. That is number one. That is the foundation for health. So transitioning to that appropriate diet.
Such a good tip, because there's so many people in here who are saying, how do you get them off the carbs? How do I get them over? My cats turn their nose up to it every time. And another kind of in that to that is they don't like the fancy stuff. I try to give them fancy things and they go back to the fancy feast diet or whatever. So can you speak a little to the quality points?
Yes. Your canned food, like even fancy feasts, Friskies, and I hate saying this, but it's true, will be better than a dry food. So if your cat likes that, start with that. And then what we can do is transitioning cats is hard. And like I said, I get it. But what we want to do is do potentially time restricted feedings with cats. Now, we don't want them starving because cats can get sick if they go too long in between foods. But if we're putting something down and offering it for a limited amount of time and then taking it away. So we do this a lot with dogs, and cats are not small dogs, but showcasing like, this is your option. Are you hungry? Seeing what they do. Offer. The other thing that you can do to help transition to a canned food is take that dry food that they love, crush it up a small amount and sprinkle it on the wet food. So they get the little bit of their tasty high carb treats from their old food. And we're hopefully getting them used to the new food because they get a little bit of that. So that's another way to offer that. And I would try that by itself versus having the dry next to it if you are adding the dry on top of the canned food. And you may have to find, my cats are really particular, whether it's pate, gravy, or chunky, they don't like the shreds or things like that. So you may have to go through some of the different brands just to see what they like.
Yeah, mine are strictly, well, my one is strictly grilled. It must be grilled. And I always laugh because this is my feral kitty who has some serious particularities. And I'm thinking to myself, you don't have to catch it. Come on. And she's like, nah, I'm real picky now that I live here. Oh, gosh, it's so funny. So, Dr. Katie, we could just, again, like all of our speakers here this weekend, it's like, can we have a whole weekend of just content and questions with you? I know we weren't able to get to all of them. Please make sure. And if you want to real quick, flip back to your contact slide so everybody can write it down, because like Dr. Katie said in the beginning, she does private consultations. So please reach out to her for these consultations, because honestly, in my experience, what you can solve in just a few one-on-one conversations, it's phenomenal. So this is not like something your mind will be blown. Okay, just call her. Okay, you'll know, I promise. And we've got a few more hours of amazing content. I hope, Dr. Katie, you'll join us. You guys will see her over with Cat Coach Becky for sure soon, because she's one of my favorite people to talk with, has amazing information. And thank you again so much for being here, Dr. Katie.
Thank you so much for having me, and thank you to everyone that showed up live. You guys are amazing pet parents, and I appreciate all of you. You're why I love doing what I do.
They're the best of the best here at Basepaws, and so they're the best to work with because they all want to do better, and to have them value this information. And I know you'll be hearing from them, so I'm so glad you could join us, and we will see you guys soon.
All right, thanks.
Bye.